Today we have with us Dr. Xelenia DePeña. Dr. DePeña is board certified in family medicine, and she is the medical director of Valley Medical Group Primary and Walk-in Care in Dumont. She's going to talk to us about our bodies as we age. Thank you so much, Dr. DePeña, for presenting today.
Hi, thank you, Sue, and thank you everyone for joining us today. Hopefully everyone has shoveled all their snow and is ready to learn a little bit of what happens when we're aging. So I want to go through today's talk and just a couple of objectives that we have today. So just knowing what adult health, older adult health looks like in the United States, what kind of changes to expect, common diseases that we see in older folks, and treatment and prevention. Okay, and this will be from a primary care perspective. So we got our statistics from the CDC. The life expectancy from 65 years old, people are aging well into their 80s and sometimes a little higher, but on average, we see that people are in their 80s. Women are outliving men about a year or two more. When patients or people were surveyed for health status, we see that about 24% of people rate their health as fair or poor, so a little work there to do. Self-care status, meaning people that are able to care for themselves in older age, is about, there was about 10% of patients who thought it was a little difficult to care for themselves. They surveyed weight, so we see that men and women in the 65 to 75 age group are about 40 to 45% overweight or obese. And then we have patients that are 75 and older, and about 30% or 35% are overweight. So we'll talk about that. Tobacco use is in about 8% of patients, and these stats are as of 2022. Hypertension or high blood pressure is seen in about 24% of the population. And for patients that are 65 and older, the leading cause of death is heart disease, cancer, and COVID. And that's because of the data, obviously, in the last 4 years. It's been the time that we have the data for COVID, but right now, those are the top three as of 2022. So more or less, we have an aging population, that there are some things that really we need to discuss that will help with preventing these things. These numbers are still a little bit high, and a lot of it will come with like just having that care, that follow-up with a primary care provider. So a little bit of med school, okay? So your body is changing. The fundamental part of any human being is a cell. Cells are the smallest basic unit of life. This is how we're formed when the egg and the sperm meet, and it multiplies into trillions and trillions and trillions of cells. These cells have the ability to form into any type of cell or specialty or specialized cell that will eventually come together to form a tissue, an organ, and eventually a human being. So because we're all made of this fundamental unit, we have to understand how it works. So essentially, cells with age will decrease in their functionality, they will change in appearance, and eventually some of them die, some of them are replaced, some are not. So this is why we age, because this is our fundamental unit. So as we age, our cells, tissues, organs, everything else ages with us. Some functions and some systems are better at coping with this aging, but some of our other systems, they do require a little bit more care, which we can do on the preventative side with how we eat, sleep, and other things and that we can do to help with our aging process. Okay, but this is a normal process that everybody will go through. So once we have all the cells and they become tissues, they form what are known as our organs. A brain, kidneys, heart. These are our organs. As you can see by the diagram, we have all the different types of organs that we have. And aging is going to differ amongst these different organs. Some cells are able to replace themselves and some die and we don't replace them, so we just end up having less of them. This is seen mostly like in the reproductive organs, so like the testicles, ovaries, liver, kidneys. They lose the number of cells, so their function will diminish with time. Still functional, but it will be a decreased function. Then we have certain diseases that can kill off some of our cells. So most commonly when a person has a stroke, Alzheimer or Parkinson, we see nerve cells and brain cells are lost and are not regenerated. So there can be permanent disability and disease when that happens. So our body is made up of 30 trillion cells in the entire human body, and we have about 200 different cell types. And this is what is our fundamental unit and how we are organized. So now when we age, one of the main systems that patients will come in, in primary care visit, they have bone pain, they have muscle pain, they have these different types of aches and pains. And this is because the musculoskeletal system, right? We have a couple of different organs within that system. And this is where we start to see changes in our body that patients actually come in for, right? So they might have a knee pain or an elbow pain or back pain. And before I get to the arthritis, more importantly, we have sometimes bone loss. This can be described as either osteopenia or osteoporosis, which are the diagnostic names. And depending on how much bone loss you have, you would fall in either normal osteopenia or osteoporosis. And this process actually really begins really young. It starts about age 30 for both men and women. And it's accelerated for women once they reach menopause. And essentially, there's a lack of calcium and vitamin D as we age because of our absorption in the stomach decreases. So what's the risk here is when patients have a weaker bone, they're more prone to fractures, hip, spine, wrist. They're also prone to choking because our bone, as you can see in this diagram, the patient's spine is curving forward. So that upright position does no longer exist, which is maintained by the spine. So choking can become a hazard as we age too. And this is because now our anatomy has changed, right? So the way that we counsel patients on this is treatment and prevention, right? So eating a balanced diet, vitamin D in your diet, calcium. Sometimes patients have to supplement if they're not getting enough of it in their diet. Sun exposure, because that's how we produce our own vitamin D. There's treatment if patients actually have osteoporosis. We do treat that with medicine. Exercise regularly, and a reduction of alcohol and caffeine as we get older. And then as far as screenings are recommended in women every 2 to 3 years that are postmenopausal. So once they have the loss of their menstrual period for more than a year, that's considered menopause. And there's certain populations that have a little bit of a higher risk. So Caucasian women, Asian women, positive family history, a person who has multiple fractures or a low body weight or a smaller frame. Those patients have those risk factors where we're going to screen them sometimes younger than 65. Okay, but usually 65 and above is when we might start the screening. But if these risk factors are identified, then we start sooner. So everybody comes in for knee pain. This is the one joint in our body that takes a lot of wear and tear. So just think of driving your car on potholes every day, all day. This is what happens to our knees. We get a lot of breakdown, inflammation, wear and tear. This is an accelerated process if you're an athlete or a high-performing athlete, which is why you see a lot of professional players, they age out in their 30s, which is young, but not if you're a high-performing athlete, because of the wear and tear on the joints. And essentially what's happening is there's a thinning of this cartilage right in between the two bones, so you no longer have that separation of bone, and then the bone on bone creates the inflammation, which creates the pain. So patients come in, they have pain, they have swelling, sometimes redness, there's decreased mobility, or walking can be difficult, use of the joint is difficult. So patients, a lot of times what we'll have to do is change the type of exercise they do, right? So if you're a runner, it may not be good to run anymore, maybe switch to like an elliptical anything, swimming, low pack exercises, weight loss if the patient has gained more than 10 pounds, oral or injectable pain management, so Tylenol, Motrin, steroid injections. And if it's really severe, a lot of patients will go for a knee replacement if there's just no improvement with initial treatments. So this is just wear and tear over age. And again, it will be very different depending on your level of activity, and also if there's any injuries, things like that, recurrent surgeries, things like that can also cause the arthritis. And weight gain, so more than 10 pounds also can cause pain. So as we age, our muscle mass and strength starts to decrease. And again, it happens around 30. And it's going to continue throughout our lifetime. Most human beings will lose about 10 to 15% of their muscle mass. And most commonly, this is going to be caused by lack of physical activity, and in men, lower testosterone levels. So the treatment is to exercise, right? To keep that regular exercise, stay active, because it's going to help with blood flow. It's going to help with immune function. It's going to help with increasing the muscle mass and strength again. Oxidative effects, which helps with inflammation. It increases people's function and mobility. It helps regulate our blood sugars, our blood pressure, and just overall body composition. The leaner that a person is, the better overall health they're going to have, even if they have conditions such as diabetes, hypertension, high cholesterol. A leaner body is always healthier because your body will naturally do what it's supposed to do, like regulating our sugars and all the other things that are natural processes. Body fat, for everybody, it doubles by the age of 75. So it is very important to maintain a weight throughout your lifetime, the same weight. Give or take 10 pounds is okay to gain, but once patients gain over 10 pounds in a lifetime, that's an issue for overall health, right? So we always stress to patients that naturally you're going to gain weight. So if you're not eating properly or you're not active, you're going to gain weight too. So these are the things that we can do to prevent it. A lot of times patients will gain the weight in their midsection, so the abdomen. And that is where patients come into issues with cardiovascular health. So diabetes, hypertension, stroke, a high cholesterol, things that can be life-threatening if they're not controlled. So again, healthy diet, regular exercise, and weight maintenance. So if you've ever been in your favorite restaurant that has the nice dim lighting, and you have to hold out your menu in front of you as she is doing, your vision is changing, okay? This happens to all of us, okay? By the age of 40, we've had a lot of changes in our eyes. And this comes from loss of the near vision, so closer than 2 feet. Because our different things in the eye have changed, right? So our nerve cells, we lose the amount of nerve cells we have. So now we're losing our depth perception. Our lens, they start to stiffen, they become dense, they're yellowing. So now it's harder to see closer objects. It's difficult to see in dim lighting. It's difficult to discern between colors. The pupil is slow to react. So there's an issue with glare. So if you notice, like nighttime driving can sometimes be difficult if you have an oncoming car. And then lubrication is decreased as well. So there can be some dryness and blurred vision with that. So change in vision is actually the first undeniable sign of aging. Usually your partner, whoever's sitting with you at that restaurant, will point it out to you, and you'll have to borrow their glasses, right? And so we expect that by 60 years old, your vision or the need to use brighter light is 3 times more than a 20-year-old, right? So it's a significant difference. And then some patients, they might experience little floaters where they see specks of debris across the visual field. This is normal. And it increases with age. It's usually not concerning, but always should be followed up with a as an adult, you should be seeing an eye doctor every 1 to 2 years. For patients that have certain medical conditions, it's every year or every 6 months, depending on their conditions, but at least routine screenings every 1 to 2 years with the eye doctor. So someone's looking at the back of your eye, the nerve, the vasculature. And then on the outside, we can see vision changes will happen because the actual appearance of the outside of the eye, you see here, the eyelid has come down a little bit more, so going to obstruct your visual field. You might get some calcifications from calcium or cholesterol. And then the eyes appear to sink into the head, but that's really because as we age, we do lose fat in our face. And so that can have a sunken appearance, but it's just because the fat keeps us nice and plump in the eye and facial area. So if we lose fat in our face, you'll see like now there's some changes in the vision because of the structural changes in the eye. So ear, nose, and throat. The ears change. We can experience some hearing loss. About 25% of people 65 and older have some type of hearing impairment. By age 75, it's about 33%. So there's options for that. And this is also can be accelerated if a person has a lifetime of noise exposure. Besides aging, this can be sooner than 65. So it's very important if you work in a job that has loud noise exposure that you use the proper equipment. So earmuffs or plugs or things like that to protect your ears. And then patients will notice that notice this because high-pitched sounds are the difficult thing to discern. So imagine listening to a violin, it's not going to sound as bright. Words are hard to understand. So consonants, things words that have a lot of consonants are difficult to understand. And so we treat this with hearing aids, okay? And a lot of times even discerning high-pitched voices, so like women and children tend to have high-pitched voices, so that can be difficult to hear, or being in a loud area or being in a group with a lot of background noise. This is what patients will usually complain about or notice. So the mouth, we experience loss of taste because we have a diminished number of taste buds. There can be a decrease in saliva production, which can lead to things like dry mouth, bad breath, changes in speech and swallowing. Gums can recede, so that allows bacteria and other particles to deposit, which can create tooth loss, cavities. And so this is another important topic because dentistry is not well covered. Once you turn 65 and above, dental care is not well covered, so you really have to actually invest in good dental insurance. But aside from that, regular oral hygiene and care, so brushing, flossing at bedtime especially is important. Medication reviews with your healthcare provider, because there are medications that can cause some of these things, like the dry mouth or the saliva decrease, so like a decongestant, antihistamines, certain medications, they do cause drying, so there's certain things that we do to prevent that, like drinking with a lot of water, avoiding sugary and acidic foods and beverages, spicy foods, dry foods near bedtime. There is treatment for the dry mouth. There's a couple medications. Patients can use sugarless candy or gum, Vaseline for like the dryness, a cold air humidifier, just some more home remedies that can be used. But really important is going to be like your flossing, your brushing, and then just seeing a dentist at least 2 times per year, because a lot that will help with prevention of some of these things. So the nose, when we also experience diminished smell, and this is because the lining and the drying of our nose and the nerve endings, they also become less sensitive. We get some hair in the nose. So taste and smell need to be fully functional for us to really enjoy like a full range of flavors. So foods, for a lot of time, a lot of people, what'll happen is they'll experience bitter tastes or bland taste. in food, because a reduction in saliva reduces your ability to taste the food, but also a reduction in smelling can do the same, because those two work hand in hand. So the skin, and with time, there's a couple things that happen with our skin. Loss of elastin and collagen, which these are the tissues that are in our skin that allow us to have full plump skin, elasticity, and avoid the wrinkling. But as we age, those things diminish. So this is why we get thinning and loss of elasticity and dryness and wrinkling of the skin. We lose fat as we age again in our face. And so the fat loss results in the actual appearance of the skin, because there's not as much support, protection, and also conservation of heat with the loss of the fat. We also lose nerve endings as we age, so we're less sensitive to pain and temperature and pressure. So this can be concerning if it's really decreased sensitivity, because patients can get injuries, especially in the feet, if they're not paying attention to, or they're walking barefoot and things like that. Loss of melanocytes. So the melanocytes give our skin its color. And this is usually from a lot of sun exposure, which we should be using SPF when we're out. And then patients can develop large brown spots, which are known as H spots, and that's from that excessive sun exposure. And essentially that happens because when we have less melanocytes, we're not removing the waste from our skin. So that's how those brown spots appear. So it's nice to go on vacation in sunny places, but you definitely have to protect your skin and wear the SPF and avoid excessive sun exposure. The other thing is that we also decrease the ability to make vitamin D as we age. So there's a vitamin D deficiency, which is important in a lot of functions. So a lot of times we'll have to either get a little bit of sun, or if we live in the north, as we all do, you need 15 minutes, even in the winter, you go outside, or we have like blue light therapy that patients can do at home if it's too cold to go outside. And then tobacco is another issue with accelerating this process. So no tobacco use to avoid, just especially in the face, patients age a lot with tobacco use, in addition to the sun exposure. So when we think about the brain, sorry if that looks a little small, our brain function declines over time, but this varies greatly from person to person. And what will happen is the neurotransmitters, or the hormones in our brains, can change. There could be nerve cell changes, there can be accumulation of toxic substances, change in the blood flow to our brain, and or inherited changes. So if there's like a genetic disposition to certain brain disorders, and this could be depression, this could be thyroid issues, this could be a history of stroke or Alzheimer's, which are common things that affect the brain. And patients will notice things like short-term memory loss, or learning new material is difficult, verbal abilities, their vocabulary and word usage might decline, reaction time or performance of tasks are slowed down, or the ability to multitask can change. So when it comes to any type of condition, if a person had a stroke or a brain injury, we always try to give patients therapy, like occupational therapy, so they can improve whatever skill they may have lost or reduced. Again, physical exercise has never been a bad thing. Regular exercise keeps us healthy. Healthy body is always going to be a healthy mind, and it helps to slow down the loss of our nerve cells. Reduce or avoiding alcohol altogether, and obviously tobacco and drugs. And then management of any chronic conditions, right? So by 65, patients may have a couple things going on, like blood pressure, diabetes, or cholesterol. So these are things that we really need to make sure that we're treating and keeping in control. So, following up with your healthcare provider. And with alcohol, this is always a tough one because people socialize around alcohol a lot. It's just following the recommended requirements, which is less than 2 drinks for men, less than 1 drink for a woman, you know, on a daily basis is considered moderate or healthy drinking, where we're not going to see this decline in the brain function. Because over time, we will naturally lose brain cell and size just as a natural function of our body as we age. For the spinal cord, a lot of patients may have or may experience medical issues like you might hear like spinal stenosis or disc herniation, things like that, because the discs in our back become brittle and hard, and they damage our nerve endings. So patients can have problems with strength and sensation and balance, or have numbness and tingling, maybe down the legs or down the arms. So again, this is a functional change where our bone is changing, our muscle and tendon, everything's changing. So that upright posture no longer is there, and patients are not going to notice it in other parts of their body because the nerves are getting pinched. So this can also result in some clumsiness or being off balance, or reduced sensation, slower reflexes, and again, accelerated by things like type 2 diabetes. So again, physical exercise helps to strengthen us, keep us upright, control our medical issues like type 2 diabetes or hypertension, so that we can try to avoid these things, and of course, avoiding injuries and falls. So the cardiovascular system, if you look here, this is your normal, a younger person's heart. And then as we age, you'll see on the diagram the thickening of the walls of the heart. So our heart is a pump, it's a muscle. And when it thickens, it stiffens, and this makes it a less effective pump, meaning that blood flow to the rest of your body can be diminished, right? It's getting there, but it's getting there slowly. But then that comes with symptoms, right? So it can be like dizziness, it can be erectile dysfunction, it could be decreased filtration of through the kidneys. A lot of this can happen in addition to hypertension, weight gain, diabetes, smoking, and alcohol. So you'll see a theme here. This is all the things that we try to treat so patients are aging well. Vasculature, same thing, because there's the thickening and the reduced elasticity of the vascular system. It's harder for the arteries to relax, and that can cause the high blood pressure that patients may experience as they get older. Again, regular exercise, avoiding anything that's a toxin, weight management. These are the things that we do to keep our heart and our vascular system healthy. The pulmonary system, so our lungs, over time and as we get older, we change our function of how we breathe. We can still breathe, of course, but the actual different functions of the lungs can change. So how quickly we exhale, how much air we can get out and in, the weakening of our respiratory muscles from in our chest wall and our diaphragm. And then there's a decrease in our lung defense mechanisms, which makes it riskier to get more bacterial and viral infections, which is why we see older patients, so 65 and above, tend to have more complications if they get a pneumonia or a flu, because their lungs are a little bit older, a little bit declined in function, so their ability to get these microorganisms out is a little more difficult. So how do we treat and prevent that? Again, the regular exercise, avoiding tobacco use, and vaccination, which we'll talk about. And this is just the standard vaccinations that we help to boost people's immune system. The other thing that patients will find if they were people that exercise pretty regularly, doing vigorous exercise might be difficult as we age, or going up in higher altitudes. So like think skiing, running, biking, mountain climbing, things like that. It might be a little bit more difficult. Not that it can't be done, but patients will notice a difference. The digestive system. So a lot of the good news is this is the least affected system, but we're still going to try and have a good diet. But patients will notice lactose intolerance, right? So we decrease the ability to break down dairy or milk products. And so to counter that, either you avoid the milk products or you can use Lactaid. But avoidance is better because you shouldn't constantly irritate the stomach. constipation, because again, we're slowing down the movement of materials through the intestines. So constipation can be seen. Side effects, right? So again, patients might be on medication, so they might be having issues with the digestive system because of a medicine. In women, we'll see some pelvic floor weakness, which can come from weight gain, postmenopause, history of pregnancy or child labor, decreased absorption of certain vitamins in our stomach, like B12. So we'll see deficiencies there. So depending on what patients are coming in for, we're treating that, right? So high fiber diet, good water intake, a review of medications with your primary care provider. Sometimes it's just a matter of taking patients off certain medications, avoiding anti-inflammatories in the gut if you're having recurrent stomach issues, taking the multivitamins to replace whatever is not being absorbed. And then for any pelvic floor weakness, there's therapy for that. Because that can get complicated and cause some fecal loss if it's not treated, and it can be uncomfortable as well. So then we have our renal system, which is comprised of our kidneys, the ureters, our bladder. A lot of changes are happening here. There's decrease again in the number of cells. So filtering is efficient, it's functional, but it might be a little less efficient, right? There's decreased volume held in the bladder. So that might look like having to really go quickly to the bathroom or frequently. The bladder muscles can weaken or they can contract unpredictably. So again, loss of urine when you're holding it, or just can't make it to the bathroom and you have this urgent need to urinate, it might come out because now the muscle isn't as strong as it used to be. Women can experience thinning of the urethra, so that predisposes them to urinary tract infections, and men can experience an enlarged prostate. So the other things that can come about are dehydration, right? Because the filtering system is not great, so patients lose more water and retain salt, and so patients dehydrate. Again, the urinary difficulties, recurrent urinary tract infections post-menopause, and then for men, the prostate being bigger, so it's obstructing the urine coming out. So we treat it with diet, hydration, regular exercise, weight management or weight loss, pelvic floor therapy. For women, there's pessaries or medications or surgery if they're having a really bad, lost my train of thought, urinary incontinence. And then screening should be done for men if they start to experience these things. We usually do a digital rectal exam to see the size of the prostate, to see if it's enlarged. And then there's hormone replacement for postmenopause, which can help with some of these issues. So the reproductive system for women, so women are gonna experience a decrease in estrogen, which will cause a couple organ changes, like the uterus and the ovaries will decrease in size. Women will stop having a period, which is menopause. They'll have some loss of tissue, lubrication, glands, and things in the vagina. There's urinary urgency, again, going back to like not being able to hold the urine. The breasts are going to change. They become softer. They're going to sag a little bit. Painful intercourse. So these things are going to happen as we lose our sex hormones. But because people lose function doesn't mean that libido is decreased. It's just getting around these things that are physiologically happening. So a lot of times we offer lubricants for patients or hormone replacement therapy if, for example, a patient is experiencing painful intercourse or they're having recurrent urinary tract infections. We're trying to treat the issue so that we can make patients have a better quality of life. Women should be screening for their PAPs, for cervical cancer, and mammograms for breast cancer. PAPs will start at age 21 and up until 65, unless there's an indication to keep doing it. Mammograms, we screen from 40 to 75. Again, we keep going unless if there's something to watch. And this is important because the breast changes. The screenings are important because now it is more difficult to find lumps in the breast. So the screening is a tool for us to catch things. And this is important to know that although your reproductive system is changing, it doesn't mean that libido, intimacy, and sexuality change. It's just again finding the right tools to enjoy that part of life. For men, they're going to, again, we experience reduced blood flow to the genitals. There's going to be a decreased testosterone level, which can reduce sperm count and libido for men. This can change the type of erections that they're having, the amount of time that the erection lasts, and then the maintenance of erections. This can also, patients will come in and have some decreased muscle mass, increase in abdominal fat, thinning of the bones. So men also can be at risk for bone fractures. Although it's not recommended to routinely screen men. If there's some risk factors, for example, if the patient was taking testosterone replacement, not prescribed, then we will do screening for bone density because they're at higher risk for fractures. Anemia can occur as well in men. So we try to treat everything that we have, the prevention and treatment of any cardiovascular diseases if they're present, making sure that at least annually minimum you're getting routine blood work, if not more, if it's indicated. Again, avoiding smoking, alcohol, and drug use. And for treatment, if a patient is having erectile dysfunction, we have medications for that. There's penile implants, there's hormone replacement for these things. And again, a lot of these symptoms are going to be seen in men that have diabetes, high blood pressure, coronary artery disease, stroke history, radiation, or prostate issues, and just making sure those things are controlled and also checking the medications can help to alleviate some of these symptoms. So we have our endocrine system, which is a group of glands and organs that are regulating various bodily functions with the use of hormones. Hormones are like messengers that are going throughout our entire body, telling everything what to do. And so over time, as you saw in the other slides, our hormone levels are decreasing. So therefore, there's going to be a delay or slowed reaction to whatever message is being sent. Some hormone levels do stay the same, and sometimes it could be that the receptor itself is just not responding. So imagine you have a key, you try to open the door, but the door doesn't open with the key. That's what happens with some hormones. It's not the key, it's the door that's not working. So we do see as we age, growth hormone is decreased, and this can lead to additional muscle mass and strength loss. Melatonin is decreased, and this will cause a loss of our normal sleep-wake cycle. So usually patients that are 65 and above will notice that they'll only sleep like 5 to 6 hours, and maybe before they used to sleep 6 to 8. So we sleep less as we age. There's usually no changes in our cortisol, insulin, or thyroid hormones, which are important metabolic hormones. Our cortisols are like our stress hormone. Insulin regulates our sugar. Thyroid regulates everything. So those don't change too much, and it's very subtle if they do, unless a patient actually has like diabetes or a cortisol issue or a thyroid issue, right? So, and those we treat if they're not correct. Then we do see some increases in like the other sex hormones, the FSH, LH, and the parathyroid, which can be with with the decrease in the kidney function. So anything that's hormonal, we either replace it or we stop it. We try to control the situation so that patients have a balance, the right balance in their body. Diet again, if a patient is diabetic, we have to control the sugar. If they're hypertensive, we control the salt, and again, the exercise, which helps to regulate this too. Our immune system. So immune system, again, over time will wane. It's not gone, but it's a slower response to microorganisms which live with us, right? Bacteria, fungus, viruses. These are microorganisms that we can't see with the eye, but they can affect us in addition to cancer cells. So as we age, vaccines that we've had in childhood do wane in effectivity. So we do boost certain things. We have found that because of this waning immunity, patients that are 65 and above have a higher rate of death for pneumonia and influenza. So this is where the primary or the preventative medicine comes in. Patients are noted to have less severe allergy symptoms, so that's a nice thing, and less common to see autoimmune diseases for older patients. Again, because the autoimmune means that your immune system is attacking itself. So we don't see that very much in elder patients. So the immune system is a system where we try to make sure that the whole organism is healthy, right? So that's a balanced diet, regular exercise, sleep, and keeping stress levels down. And then vaccination, right? So we start to vaccinate around 50 years old for shingles, which is the chickenpox, right? Same family as chickenpox. RSV is the newest vaccine that we have out, which also was responsible for a lot of death, pneumonia death in 60-year-olds. So we start at 60 for this vaccine. Pneumonia is 65 unless certain patients have indications for it between 18 and 64, but everyone at 65 is recommended for the pneumonia shot. All adults are recommended to take the flu shot, and now in the more recent times, the COVID-19. Then some kind of boosters that we recommend for patients are the tetanus shot, hepatitis A and B, depending if a patient still works in, high risk areas, so like healthcare workers, measles, mumps, rubella, varicella. Sometimes patients will need these vaccinations because they're caretakers to grandchildren, and children will bring that to their grandparents. So we tend to promote preventative vaccines to help grandparents if they're going to be caretakers or they're just going to be around their kids, or even if they're not around their own kids but volunteering in a school or church or places that they're going to come in contact with the little ones because they carry a ton of germs. And this is really the crux of medicine for primary care, right? We want patients to come in at least once per year, talk about your screenings, your vaccines, and this poses the opportunity for you to ask questions about what are your personal risk factors, why you need certain vaccines, maybe you don't need all the vaccines, and then just the routine blood work and physical exam so that we're catching things versus reacting to treating. So in summary, focusing on, you saw throughout the theme of the presentation, healthy diet, regular exercise, quality sleep, weight management, and low stress. Toxins, so tobacco, alcohol, and drug use is just a no, or very limited alcohol use. Doing your screenings and vaccines based on your risk factors, based on age appropriateness. Annual blood work, physicals, stress management, extracurricular activities, reading, keeping the mind engaged as we age, and having a plan for retirement. Many people retire at 65, and some people, their health declines because they don't have the routine anymore. And then there's a difference in physical activity, there's a difference in diet. And so these are things that we encourage patients to build so that when they do retire, they have things to look forward to and things to keep the mind and the body engaged. If there's any chronic conditions, we recommend, of course, touching base on a regular basis for diabetes, high blood pressure, high cholesterol, to make sure those things are controlled. And I always say aging is the better alternative to not aging, right? So aging is a gift, and it's recommended. You need to have patience with the body changes that all of us are gonna endure, and hopefully we're aging well, right? We're aging healthy.
Okay,
All
thank
right.
you so
I think
much.
that's everything.
There's some references there. I did just put into the Q&A area about where to re-see this lecture or re-listen to it. It is www.valleyhealth.com/tune into health. I'm sorry, www.valleyhealth.com/tune into health. And I did write that into the Q&A area. Thank you so much. Somebody had an interesting question about when somebody is too thin. I know that is not typically what we get concerned about in America.
Yeah, that's a really great question.
Yeah,
So that so when patients, what about the question is, what about if a thin person lost 10 pounds?
right.
So that weight is an objective measure, right? So the way that we look at that is when a patient comes in and we look at their history. And let's say an example would be a person that's like 95 pounds. That's like their base weight. And then they're 85. That could be a little bit more concerning because you have to look at the patient, right? You have to see what is their physical exam looking like. Is it just that they lost the weight? Maybe they have a decreased appetite. Maybe there's some depression there. Maybe there's they were hospitalized and they're physically deconditioned. So it's not so much the amount of weight, it's the what does the patient look like, right? What's the whole clinical picture. So, but we do look at trends, right? We look over a span of time, like over the last 10 years, this patient's always been 95 pounds and now they're 85. What happened for them to lose that? Was it intentional or not intentional? So that's we'll have to make a judgment or a clinical decision on if that's an unhealthy situation. And then what the next question was, what do you mean by Vaseline? Do you put it in your mouth? So the Vaseline is it's good for patients that get dry, dehydrated, because any cracks or sores in the mouth can lead to infection. So we like patients to keep their skin lubricated, right, as much as they can. It's a good moisturizer. Any
Wonderful. And
And
go
then I
ahead.
have two more questions. Are
Please.
you more prone to depression as you age? That is a very good question. So what I have seen in practice, so if you have a history of depression, yes. If you do not have a history of depression, yes, you can have episodes of depression, right? There could be a traumatic event. So as I mentioned, retirement is a very traumatic thing for some people, and that in itself can cause people to have it, not to say that you're depressed, but you can have a depression episode, right? Like you can have a couple months where you're just in a rut and it needs to be addressed. So it just can depend the circumstance. So some people, they don't have a plan for when they retire, and then they're isolated, they're not talking to anyone, they're not going out and getting some sunlight, so there's a lot of changes. There could be some financial difficulties. So yeah, you can get depressed, and we have seen depression go up in certain patient populations. So usually we see it a lot more in white older men. They will tend to get depressed around retirement age. We've seen that statistically, but it's not uncommon for other populations too. So there could be different factors. And
Absolutely.
what is the best resource to find reliable home health care for an aging person? Also a great question. So usually with a primary care provider, for example, like Valley, we have a home healthcare department. So whenever a patient is identified to have certain risk factors or issues or really sudden change in their healthcare status, we refer to our group and they check if their benefits with their insurance. Some patients qualify for benefits through their insurance, and some patients have to private pay. So that really all comes down to insurance coverage. But like Valley, for an example, we have a department that offers that service. So we go, and then it's funded through the insurance if the person qualifies.
Yes, and there's the number at
Yep.
the bottom,
Yeah.
Valley Home
And
Care.
they're great. We have an
They are.
excellent home health department.
201-291-6000. Very good. Yes, and just like you said, Dr. DePeña, it's great to ask staff at your doctor's offices, if they know of anybody, and you want to make sure that any home care service you use is accredited, reading reviews, all of those things. So very important.
Yeah.
Well, thank you so much for this
Thank you,
wonderful,
everyone.
very
Thank you for your time today.
comprehensive program. I'm really glad you all tuned in.